Multiple myeloma is the disease of plasma cell. Plasma cell, as you know, is a memory cell which can reside another time in the bone marrow. It is able to secrete interleukin 6, which can activate the osteoblast, causing consequently to bone destruction. How to stop this cell? Many drugs were developed to treat multiple myeloma, including chemotherapy from the beginning of 60s. Then researchers have developed immunomodulatory drugs such as Thalidomide and Lenalidomide. And recently we are using the anti-CD38 Datamumab. So the mainstay of treatment and the purpose of treatment is to make an induction in order to collect stem cells in order to make autologous stem cell transplantation. That is the main purpose and mainstay of treatment during the era of 90s and after 2000s. However, bone marrow transplant is not feasible in all patients. Because of the age of the patient, of other mortalities and morbidities. That's why we developed a study in which we combined two drugs, either chemotherapy with immunomodulator plus dexamethasone or minus chemotherapy. So we have included about 123 patients in our study. They were allocated to 3 arms. The first arm, patients were treated, about 40 patients were treated with Bortezomib plus Thalidomide plus Dexamethasone, the other with Lenalidomide Dexamethasone, and the other with Velcade Dexamethasone or Bortezomib Dexamethasone alone. And we have evaluated the patients every three months. So after the 3 months of treatment, we have got about 65% with complete response. And after the end of the 6 months, another 22% of patients have joined the first responders to make a response of 88%. So what to do in this case? So what is the notion of intermittent treatment? So as you know, immunomodulator has a very tremendous side effects, especially neurotoxicity. So not all the patients are able to continue their treatment for continuous fashion. That's why we stopped our treatment in case of good response, and we gave the rest for our patients, for our responders. The rest was ranging between 6 months and 2 years. And after first relapse, we restarted the same protocol they have started on firstly. So after 2, 3, and 6 months, we've got a good response. However, we got a complete response in 50% of patients. And the 5-year survival finally was 91%, which is a huge number, which is comparable with the results of autologous stem cell transplant. So this notion is less toxic than bone marrow transplant. It is feasible in all patients. You can adjust toxicities, and you can make a rest for the patient himself and for his bone marrow to make a regeneration whenever possible.